How'd you like to sleep right through your next dentist appointment? Well, you have to show up. Don't sleep on the way there. Dr. Charles Martin showed up today, and he's going to talk to us about sedation dentistry and how to make your next visit a little bit easier.
Right.
Yeah. All right. So just take a nap, and you wake up, and everything's fine.
Well, it's not exactly sleep dentistry, but it's virtually very comfortable for a lot of people. They don't remember much of the appointment, but it's not really like going totally to sleep. But it is being sedated.
So you aren't knocking them out?
No, we're not knocking people out. No.
But you're a knockout dentist.
Oh, bless your heart.
Okay. Let's talk about this for a moment. What is it like to receive that sedation? And I'm assuming it's safe because you do it all the time.
Yeah, it is. And it is basically a person takes a pill has a sedative effect. When most people take it, it doesn't feel like they've done it. They said, I didn't do anything. But believe me, they have. They shouldn't drive on the way to the office or from it. Largely, their memory will be altered. It will decrease their anxiety dramatically and make a certain calmness of it for them. And so for millions of people who are frightened to death of dentistry, this is a real godsend. And for many people, it's just very, very difficult for them. And for others who are having major work done, this is a solution to help them tolerate a longer appointment, make it more comfortable for them.
Yeah, those people are scared to death.
Scared to death.
About just a normal dentist visit. They can use this?
Absolutely.
Okay.
Yeah.
All right, let's talk about the different dentists that use sedation.
Right.
Can all dentists do this?
Well, obviously you have to have some training in doing it, knowing what you're doing. You need monitoring equipment to make sure that our patient's doing well, which is what we do. We monitor them with a pulse oximeter to make sure their blood pressure and their pulse and everything's well. But because the person's not totally out of it, we can also talk to them and check on them. So it's very safe. I've been doing this for 25 years.
Yeah, so you got to know what you're doing.
You have to know what you're doing,
and have all the equipment and the training and everything else. And,
right.
Okay.
Yeah.
And he do. All right, let's talk about one of those before and after pictures that you're famous for, and tell us about what's going on here.
This lady wasn't happy with the patchwork in her smile, and it weaves in and out, and she has a big smile, so she wants to show that off. And so we put things there so she could, and that's a case involves lots of different parts of dentistry, including implants and all kinds of things. So
yeah, implants was whitening part of that as well?
Whitening was part of this. Veneers were part of this. There's a whole number of components that were part of this. In fact, most of these cases like this involve putting a lot of things together. And of course, that's part of the art and science of doing this kind of dentistry.
And so that's what you do, is you take someone who is unhappy with their smile, and you give them an idea of what it can look like. I mean, this is a great before and after photo here, so that they know when you're done that it is going to look natural,
right,
for one thing. It's not going to look fake, and that they're going to be happy with it. And once again, I want to go back to the sedation thing real quick, and that it is safe.
Safe.
You've been doing it for a long time,
right?
And you've got all the equipment and the training and know-how that goes with that, and it's very comfortable for people.
Well, the important thing is that what kept you from coming before now has a solution.